Good morning. Thank you. It's been a wonderful meeting. I took a lot of good notes yesterday, so I've got to try and still get it all into my 15 minutes, all the extra things I thought of I needed to say. Sustainability isn't necessarily new to this society, but reporting and being accountable and putting it out there, adding that extra element, I think has made it a little bit more steadfast and bring forth the implementation for the events that we want to make happen. So well, let me move it on. I want to talk a little bit about the NIEHS. I think a lot of people know about our institute, but we are a biomedical research facility. Our intramural program has over 100 groups that are doing clinical and a clinical research group with 692 publications for 2012. The extramural program runs 17 programs and centers working in disease research and exposure research. They had a numerous amount of publications as well. Our interagency NTP evaluates substances of public health concern. They're looking at alternative testing methods, and they want to analyze a science base for risk assessment. We have a well-developed strategic plan. I think John Bell has talked about it a little bit yesterday and how it's implementing more of green chemistry style ideas and sustainable solutions. We're currently building a climate change resilience plan, and we always have a continuing operations plan in place. We've been awarded Green Championship awards from the Department of Health and Human Services for 3 of the last 4 years. Environmental Justice Group received an award for their worker education training program. The organization received one for the sustainability reporting, and the environmental stewardship for our composting program. So let me talk about how some of those things can make a difference in how we move forward. This photo, first of all, doesn't mean to scare anyone, but we don't want to be an institution that looks like this, that from the drive up is gorgeous, but from the outside is doing this. So some of the things that we've worked on in the last 5 years have been a lot of low-hanging fruit, very easy to tackle, taking out the maybe smaller items or easier things that we didn't think about, LED lighting, composting in the cafeteria. We started with vermicomposting. We're just doing small items. Now we're doing the whole dining area. We've increased the recycling just by moving it into the labs. We're at a 90% rate. We were at a 75% rate. So the freezer initiative was an NIH project run by Leo Gamapis, the greenhouse gas manager, trying to reduce obviously the greenhouse gases. And that came from working with ultra-low temp freezers. Ultra-low temp freezers use as much energy as an 1,800 square foot home. And we had 163 of them at our institute. So with 53 of them being beyond service life of 10 years. So this project was a great way to not only reduce the footprint, but it also got people to go through their freezers. They had to do a 2-for-1 program. So they had to get rid of 2 in order to get 1. That was a great program for us. We actually got the most with 14, reduced 28 freezers for 14 at our group. Water conservation had become a highlight. In 2007, North Carolina was going through a drought at the time. We've blown those numbers out of the water. We've reduced 35% since then. So some of the behind-the-scenes things that go on, overnight shutdowns for the IT and the temperature setbacks, green purchasing from our purchase card holders, and then green IT. All of these projects are on the non-lab side, right, are coming from the admin side and helping to pull the whole system together. So this is where, this is a typical lab or a typical bench space at the Institute. One of the things that I want to point out is this is actually a very well organized space, but this group, can you believe that? I know, and I just walked the halls and I was like, oh, wow. But this looks dangerous to me. But in general, they have a very good storage system. They make some of their own reagents here. This is their actual waste storage. It's all well labeled. I couldn't find anything wrong with this lab. But what I want to point out here is of course, extreme attention to detail, including the tape marker dividing their spaces, but that this person is working right here in this space. And everything here supports what's going into this one little tube right here. So that there is this common understanding of that they are surrounded by chemicals and reagents like this all the time. It's not abnormal for them to be involved, be handling, be working with these, know how to handle the waste, and remain in compliance, I would say. The other thing is these drawers down here that are all neatly labeled. A lot of times it's supplies, but a lot of times it's another drawer full of more reagents, maybe a smaller tube size, 70% ethanol, 50% ethanol, 30% ethanol, something like that, all little derivatives of reagents that they might need for a particular experiment. 1 molar NaOH, just all kind of different things that may need on a smaller scale and that they can have handy for them. But again, it's a common prevalence of having these chemicals around that's going to require the adjustment to getting them to reduce some of those things. The other area that we focus on is from the facility side. This is just a picture of 2 of the boilers that we have. We burn natural gas to boil water, make our high temp hot water. This group focuses a lot on, of course, cost, trying to save money, and they don't always think about the greenest aspect of some of it. So for example, we have a reduction for our energy costs because we have an agreement with the utility agency to go on curtailment if there's a peak demand. So what that means though is that when they say, hey, actually in North Carolina, if it gets below 40 for 3 days in a row, that ends up being a peak demand for them. Then they'll give us an hour or 2 hours, I think, to shut off and to switch to diesel fuel. So we switch to number 2 diesel fuel. Not necessarily the cleanest burning, and something that, again, we did on a cost-based idea. In compliance, it's still in compliance, but it's just not, it is just meeting compliance. So one of the things about the facilities group is that from their perspective, where our central utility plant is actually kind of around the lake from us, they look at the lab, or they look at that building, they see 5 modules, lights are on, water's running, everything's good. From the lab perspective, they see themselves, it's almost like a Waldo kind of notion. They are Waldo, and if you've seen a Waldo book, Where's Waldo? There's hundreds of people in this group, right? So for this thing exactly, there are over 400 spaces like this that I'll have to work with. So 400 Waldos that think it's just them, and this is unique, and this is how I work, and this is what I need, and it's Nobel Prize winning research. I have to do it this way. And that's fine, but I need Waldo to maybe switch from red dye to green dye or something like that. So I would like for the Waldos to see the collective, and I would like the facilities to see the Waldos. Then maybe we can collaborate a little bit better or understand the perspective where we're going. And the reason why that is because when we look at initiatives like sustainable labs or green chemistry, I say they're lofty because, well, for that institute, it's a lofty idea to talk about sustainable labs because you can be able to break it down into smaller bits. And again, with everyone's unique perspective on their science, they're going to have something that affects them directly and other things that don't. So there will be some give and take. It's just going to be, again, on the individual basis. Whereas for the facility side, again, they have the building perspective, and I want them to think about the occupants that are in there. How are they going to use that energy? How are they going to use that water? What are they going to do with those chemicals? What are they going to do with that waste? So these are all the things that, when we look at a sustainable lab like that, I want to be able to not only deal with on a daily basis, I want to be able to deal with a climate change situation, a tornado, a hurricane, a flood, a wildfire, whatever any of those things are. Can you maintain your animal colony? How can you keep these things going without be able to take a hit and launch forward? One of the things about Hurricane Sandy, I think, for example, I heard some scientists say they lost 20 years of research. I don't think that shouldn't happen. That's what sharing's all about. That's what collaborating's all about. Everyone should have your animals or your things, or should have worked with these things. That recovery will take time, but it shouldn't be a complete wipeout of what you're doing. And that's the lesson I want everyone to learn there. Green chemistry. Not only do I want them to reduce managed waste is something that we have difficulty controlling because depending on the science that they do, that's how it comes in. This is how we have to manage it. And for example, the bar graph for that goes something like this. You know, it's not a steady number. It's not a straight up. It's not straight down. It's all over the place. So once we can get through starting for people to think about where their chemicals going, where they come from, where it's going to happen to it after that, then I can get them to reduce, find a new way to do it. But the bottom line is, at least for scientists, right, it needs to be publishable data. It needs to be repeatable. It needs to be reliable. And then for, of course, the facilities group, they want continued operations. That's all they think about. My favorite, or the most important thing for me, is to reveal the face behind the bottle. And that means when you handle that bottle, and even though you have expertise and training in how to handle this chemical or how to handle that potential waste from there, that before you, somebody harvested it, or somebody synthesized it, somebody packaged it, somebody shipped it, somebody brought it to you, somebody put it on your desk. Now it's on your desk. Then where does it go? Who's going to handle it? Who picks it up? Who takes it there? Where does it go after that? These are the things that I think hopefully will help people think twice about how much they use or where they go or not being wasteful. So one of the ways that we get started, I talked about the balanced and bite size. I want everyone to be able to tackle it in a little bit of a way. For example, well, players, of course, are Staff Institute and the budget. But when we target a laboratory, for example, I want to talk about the inspections and purges. Again, compliance is something that's always maintained, but to have a group that's been there for 30 years to reduce the amount of, or they start to accumulate, start to hoard, if you will, some of the things that they have. And postdocs are coming in and out at a perhaps 3 to 5 year rate. And I'm saving this for this person, and somebody might need that, and the next person might work on that, and then these tend to build up. And then that belongs to somebody else. They're not going to get rid of it. Nobody wants to touch it, that kind of thing. So it's not necessarily out of compliance. It's labeled. It's well known. It's not expired, but just doesn't belong there. So one of the ways, so this will be our first step, is working on inspections and purges, getting them to take a look at what they have, getting them to create an inventory, because then I can use that inventory and I can keep track of what they're using, because the next step then is how much are they using of this item or that item? You know, what is it that they're using the most, and how to drill down and get them to reduce that and promote greener methods. Common space and environmental rooms, another catch-all. Common space sometimes is where equipment rooms are, or they have storage you know, they'll buy cases of plastic consumables, things like that. And then the environmental rooms are cold rooms. Again, same thing that, that they end up, that end up becoming catch-all and need to have a walkthrough, they need to have accountability, and need to have reliability. That's crazy. 10 pages left. Okay. For operations then, in getting green at that project inception, seems to be that green doesn't come in until as an afterthought. The project's 90% decided, and of course there's no extra money, and green almost always means more money. So it's got to get in at the beginning, and then you can have the trade-offs. Another trade-off that operations deals with is something that has, for example, dealing with gray water. They want to bring gray water in, use it in the cooling towers, stop using potable water in the cooling towers, but they want to treat that water before it goes in. Well, that means a 300-gallon tank of sulfuric acid. That's the trade-off. We end up, you know, hitting the load on the other side. NIH funding and EHS funding. Had some people come to me who want to talk about greening the grants. Greening the grants, grants are merit-based science documents. I can't really adjust for those, but I can do work on grantees and try and get them to, you know, make the efforts that they have to get their operations going and keep them up to date. So that, okay, we talked about reducing, if our focus is reducing chemicals in society, measuring and reporting, of course, is the most important thing. Being accountable, establishing metrics, you have to start there. Implementing programs like these and making new programs and setting strong goals, sharing your best practices. I encourage all of the, and will encourage the scientists to, if they want to do dual green, non-green type of experiments, include that on their poster, put it up there. We're an environmental institute, you know, we should be doing this. The NIEHS scientists have a dual purpose. They report science related to toxicology, and they need to do it in the least toxic way. And they should promote that. I think they deserve it. So it's a group effort, of course, not a one-man band. Health and safety branch is great. Our global environmental health group has great ideas. Well-established environmental management system, environmental awareness committee. Of course, the employees and staff have to do it. And engaging them is going to be key. So how can you ruin a beautiful campus like this and 320 acres with 211 acres of forest? It's a beautiful place, and I wouldn't want to destroy it for anything. So, thank you.
All right, so imagine you could get a product into every home in America, in fact, maybe every home in the developed world, and you're responsible for the sustainability and the environmental responsibility of that. Our next speaker, Stephanie Jordan, actually has such a job and has such a responsibility. She is the Vice President, of Global Regulatory Affairs and Product Stewardship at Johnson & Johnson's family of consumer companies. In this role, Stephanie is responsible for leading the development of global regulatory strategies for new products in the R&D pipeline across a broad portfolio of health and personal care products. She's also responsible for the regulatory policy agenda at J&J and is leading the product stewardship initiatives and strategies as it pertains to ingredients policy.